Hello, we're Wellbeing for Us, a digital wellbeing platform designed for you. We offer one-to-one support, workshops, advice and mental health awareness. In today's webinar, we are going to be discussing eating disorders. If you feel affected by anything discussed today, please get in touch with us. In addition, at the end of the webinar, there are also helpline numbers you can ring that are completely confidential. Please reach out for help if you feel uneasy or feel like you may be suffering. These are all our social media contact details. In today's webinar, we will be discussing the symptoms, causes, risk factors, and treatments for eating disorders. Eating disorders are mental health conditions where unhealthy eating behaviours are used to cope with difficult feelings and issues. Unhealthy eating behaviours may include eating too much or too little, or worrying about your weight and body shape. With treatment, most people can recover from eating disorders. So there are lots of different types of eating disorders. These can include anorexia nervosa, bulimia, binge eating disorder, and also avoidant and restrictive food intake disorder. Offset is also another type of eating disorder, so a person may have offset if their symptoms do not exactly fit the expected symptoms for any specific eating disorders, so it can be also the most common eating disorder. So these are some symptoms of some eating disorders. So if you or anyone around you that you're worried about, you feel like they have an unhealthy relationship with food, you could have an eating disorder, and if you don't have to have all of these symptoms, it may just be a few of them. So these are some physical signs that someone may be suffering from an eating disorder, or also some physical signs that you may be suffering. So please reach out for some help if you relate to any of these symptoms and physical signs. So these are all the warning signs to look out for. So if someone close to you is suffering from one of these, or you feel like this is quite obvious, then you really should talk to them, reach out to them, show them how loved they are, and also contact their local GP and ask for some help and support. So how to help someone suffering? It can be extremely difficult to know what to do when you're worried about someone having an eating disorder. The person that you are worried about may not even realize that they have an eating disorder. They may deny it, they may be secretive and very defensive about it, and therefore it's very hard to bring up. But let them know you're worried about them and encourage them to go and visit their GP. If you relate to some of the signs that we've spoken about previously, then please contact your GP. I know it seems scary, but they will offer you so much support and help and will be there for you and can advise you the best route that is for you. So these are some causes and risk factors that may be a cause of why you have an eating disorder or why someone that you love may be suffering. So we're now going to talk about some treatments that are available for eating disorders. They will cover a wide range of different eating disorders, and each treatment will be different depending on what eating disorder you have. So treatments for adults are different to treatments for people that are under 18 years old. So treatments for adults include a number of different talking therapies which are available, and the aim of these treatments are to help you understand the causes of your eating problems and feel more comfortable around food. So one type of talking therapy includes cognitive behavioural therapy, also known as CBT. It allows you to change your negative thought patterns into positive thinking patterns, and it will help you to cope with your feelings, understand your nutrition and the effects this has on you and your body and your health, and also encourage you to make healthy food choices. Mantra is also a treatment for adults. This is specifically for if you are suffering from anorexia and cannot be used for other eating disorders. This is another type of talking therapy, which is usually offered if you feel like the above therapies aren't right for you. Another type of treatment for eating disorders is Sscm, which involves talking to a therapist who will help you understand what's causing your eating habits. There's also medicine that you can take, which is another form of treatment for some eating disorders. Medicines do not work for everyone, and I personally would recommend trying a talking therapy before you try medication, but you should be talking to your GP and they can direct the best route for you. So treatment for children and young people is different to treatment for adults, although CBT is also offered, and it can also be offered with the guardian or the parent of the child or as an individual by themselves. Family therapy can also be a very effective treatment for children that are suffering from eating disorders and also young adults. So this will consist of having therapy sessions with your family and or on your own with the therapist. Another treatment is adolescent focused psychotherapy, where the therapist will help you cope with your fears about gaining weight and understand what you need to do to be healthy and the effect of undereating. So here's some advice for parents out there that they may be worried about their child or their young adult who may be suffering from an eating disorder. Here's some further advice that we recommend. It's really important to support your child or your young adult that is going through this. So try and educate yourself and learn as much as possible about what they're suffering with. Keep telling them and encouraging them that you love them and reassuring them that you're there for them is really important as well. Here's some further examples of how you can support your child and help them. Workshops are also another form of treatment for eating disorders, and they are really effective for all types of eating disorders that we've talked about. The National Centre for Eating Disorders offer recovery workshops for people who might want something different from traditional eating disorder treatment centres such as talking therapies and CBT, like we spoke about earlier. So recovery workshops might benefit you if you find the following about yourself. We really hope we've helped you today. If you are struggling, please reach out for help and speak to someone, whether that's Wellbeing for us or a loved one. We know it's so tough opening up, but it will make you feel so much better. On the next slide, there are some phone numbers of mental health helplines. These are completely confidential and just a way to speak about how you are feeling, and they can direct you to the right place, offer you advice, and most importantly, support and help you. So please call or text one of the following numbers if you are struggling with your anxious thoughts and are worried about anything at all. We are all here to help you. Thank you so much for watching and listening today. Get in touch at wellbeingforus.com. We offer one-to-one support with therapists and psychologists and offer workshops and advice for you. Thank you so much for watching and listening today, everyone, and we really hope that we've helped you and advised you and offered you support and awareness around this topic. Also, feel free to get in touch with us on our socials. We love to have a chat and are always only ever a DM away. Take care. Bye, everyone.